Did you know that after the age of 60, the risk of deficiency in essential vitamins practically doubles? And what's even more alarming, this deficiency could be silently stealing precious years from your life. Most people believe that simply eating well is enough to stay protected. But unfortunately, that's only half the truth. Nutrient absorption by the body declines drastically with age, even when maintaining a balanced diet. The result? A more fragile body, a slower mind, and deteriorating health without clear warning signs. Have you ever felt more tired than usual, even after a good night's sleep? Have you experienced memory lapses that didn't happen before? Or bone and joint pains that seem to appear out of nowhere? These could be warning signs that your body is calling for help, and perhaps all that's missing is a small adjustment in 4 fundamental nutrients. Today, we'll talk about the 4 mandatory vitamins after 60. These are natural, accessible, and scientifically proven substances that help prolong life, improve energy, strengthen immunity, and prevent serious conditions like osteoporosis, heart attacks, and even Alzheimer's. And pay attention until the end, because the 4th vitamin is, by far, the most powerful and the least known. I'm Dr. William Tharnell, a specialist in elderly health with over 25 years of experience in geriatrics and integrative medicine. My commitment is to your longevity, vitality, and independence. If you're over 60 or care for someone who is, leave a like on this video, subscribe to the channel, and turn on the notification bell. This helps me bring serious and useful information to more people. And tell me in the comments, do you already take any vitamins regularly? Which ones? I'll read your responses carefully. After 60, the human body undergoes profound and inevitable changes. One of the most dangerous and silent is the decline in nutrient absorption. What was once easily assimilated by the body is now more easily lost. This happens for 3 main reasons. First, the production of hydrochloric acid in the stomach decreases with age. This acid is essential for breaking down food and releasing nutrients, especially B-complex vitamins and minerals like iron and zinc. Without it, absorption is compromised. Second, the liver and kidneys, organs responsible for metabolizing and distributing these nutrients, also lose efficiency over time. They work more slowly, impairing the activation of vitamins like D and K2, which need to be converted into active forms to function in the body. Third, many seniors take continuous medications that directly interfere with vitamin absorption. Antacids, for example, further reduce stomach acidity. Diuretics increase the excretion of important minerals through urine. And medications for diabetes or blood pressure can interfere with vitamin B12 metabolism. The result is a dangerous scenario. Even with a good diet, many seniors live in a state of chronic nutritional deficiency, which weakens the body, brain, and immune system. These deficiencies don't cause acute symptoms like the flu or severe pain. They settle in slowly, wearing down your health day after day, until more serious problems arise. Osteoporosis, mental confusion, constant fatigue, muscle loss, low immunity, and even dementia. That's why understanding this process is the first step to reversing it. Vitamin supplementation after 60 isn't a luxury, it's a vital necessity. It can be the difference between aging with health and independence or spending years battling preventable diseases. International studies show that vitamin deficiencies are directly linked to the development of conditions like osteoporosis, cardiovascular disease, depression, type 2 diabetes, and even neurodegenerative diseases like Alzheimer's. And the worst part? These deficiencies often go unnoticed for long periods until the damage becomes visible and often irreversible. It's as if the body is running on an ever-decreasing energy reserve. Until one day, it simply can't compensate anymore. And then the symptoms appear: loss of muscle strength, difficulty moving, frequent falls, forgetfulness, chronic pain, recurring infections. Supplementation doesn't mean taking supplements on your own. It means understanding the real needs of the mature body, getting tests, observing subtle signs, and acting preventively. With guidance, it's possible to balance the body before problems arise. Science has already proven, maintaining adequate levels of certain vitamins can reduce the risk of chronic diseases by up to 40% and increase healthy life expectancy by years, not months. We're talking about autonomy, mental clarity, energy for simple daily activities, and quality of life. That's why, from now on, we'll explore these 4 mandatory vitamins for those who want to age with vitality. Vitamin D, the pillar of immunity and bone health. Vitamin D is undoubtedly one of the most important vitamins for those over 60, and also one of the most neglected. It acts like a hormone in the body, with functions that go far beyond calcium fixation in bones. Vitamin D is essential for immune system function, muscle strength maintenance, cardiovascular health, and the prevention of autoimmune diseases. The problem is that with aging, the skin loses its ability to synthesize vitamin D from sun exposure. To produce the same amount of vitamin D as a 30-year-old, someone over 65 needs up to 3 times more direct sunlight. Additionally, many seniors avoid sun exposure due to medical recommendations, sunscreen use, or physical limitations. And even in sunny countries, studies show that over 70% of seniors have insufficient levels of this vitamin. In countries with long winters, this number is even higher. Vitamin D deficiency is linked to an increased risk of fractures, falls, respiratory infections, depression, and even colon cancer. In a study published in the BMJ, seniors with severe vitamin D deficiency had a 2.5 times higher risk of death from any cause compared to those with adequate levels. That's why vitamin D is considered a true pillar of longevity. It helps protect your bones, strengthen your immune system, and maintain your physical autonomy for longer. Vitamin D deficiency often sets in silently, making it especially dangerous for those over 60. Often, the signs are mistaken for normal aging, and the problem goes unnoticed for years. Do you feel muscle weakness when climbing stairs or getting up from a chair? Have you had falls for no apparent reason? This could be more than just fatigue. It could be a reflection of low vitamin D levels in your body. Other common signs include bone pain, especially in the lower back and legs, slow wound healing, persistent fatigue, mood changes, unexplained sadness, and frequent infections, particularly respiratory ones. An important but lesser-known symptom is insomnia. Vitamin D participates in sleep cycle regulation, and its deficiency can cause difficulty falling or staying asleep at night. Additionally, low vitamin D levels have been associated with depression and cognitive impairment. This means that instead of just being low mood or normal age-related forgetfulness, it could be a sign that your body needs help. These symptoms don't always appear together and are often subtle, but ignoring them can be costly. That's why medical evaluation and lab tests are essential to identify the problem and start correction. The most natural way to get vitamin D is through sun exposure. When sunlight hits the skin, especially between 10 a.m. and 3 p.m., the body begins producing the vitamin. However, after 60, this ability declines drastically. For seniors, 15 to 30 minutes of direct sun exposure per day, arms and legs uncovered, without sunscreen, may be enough in sunny regions. But even then, many factors interfere: skin color, pollution, clothing, geographic location, and season. That's why supplementation is often necessary. The exact recommendation should come after blood tests, but most experts consider ideal levels above 30 nanograms per milliliter. Vitamin D supplements are available in capsules, drops, and even versions combined with vitamin K2, which helps direct calcium to the bones and prevents it from accumulating in the arteries, an important point for cardiovascular health. It's crucial to follow the doses recommended by a healthcare professional. Self-medication, especially in high doses, can lead to toxicity, causing nausea, vomiting, loss of appetite, excess calcium in the blood, and kidney problems. The secret lies in balance. When used correctly, vitamin D becomes a true ally against bone fragility, falls, infections, and physical decline. Vitamin B12, energy, memory, and dementia prevention. Vitamin B12 is one of the most important vitamins for brain and nervous system health, and also one of the first to decline as we age. It plays a direct role in cellular energy production, red blood cell formation, and cognitive function maintenance. Without it, the body slowly collapses, affecting everything from mood to motor coordination. After 60, B12 absorption from food becomes more difficult. This is because digestion depends on a protein called intrinsic factor, produced in the stomach, and its production declines significantly with age. The continuous use of medications like metformin and antacids further aggravates this process. Vitamin B12 deficiency can manifest with symptoms like extreme fatigue, tingling in the hands and feet, memory loss, mental confusion, irritability, and even hallucinations. In more severe and prolonged cases, it can lead to permanent neurological damage. Studies show that low B12 levels are linked to a higher risk of depression in seniors, as well as cognitive impairment and progressive mental decline. The good news is that proper supplementation can reverse many of these symptoms, especially when done early. Vitamin B12, therefore, is a pillar for those who want to preserve their mental autonomy, maintain energy, and protect the brain from premature aging. B12 deficiency is insidious because its signs appear slowly and are often mistaken for normal aging. But ignoring these symptoms can pave the way for serious, sometimes irreversible, problems. One of the first signs is persistent fatigue, even after a good night's sleep. The person starts feeling drained for simple daily tasks. Walking, climbing stairs, shopping, everything feels more exhausting than it should. Another typical symptom is tingling in the extremities, like fingers and toes. This happens because B12 is essential for nerve health, and its absence impairs electrical signal conduction in the body. Memory also suffers. Frequent forgetfulness, difficulty finding words, confusion in simple situations, all of this could be linked to a lack of this vitamin. Many cases diagnosed as early dementia were actually B12 deficiency. Additionally, the skin may become paler, the tongue may develop sores or a burning sensation, and mood may shift. Anxiety, sadness, irritability, and even episodes of depression can arise without apparent cause. A very important sign is a feeling of unsteadiness when walking, as if frequently losing balance. This is serious and should be investigated immediately. Paying attention to these signs is a powerful form of prevention. Early detection makes all the difference, and proper supplementation can restore vitality and clarity in no time. Vitamin B12 is found exclusively in animal-based foods, which already poses a challenge for many seniors who follow diets low in meat, milk, or eggs, whether by choice, medical restrictions, or chewing difficulties. The main natural sources include liver, red meat, fish like salmon and tuna, eggs, and dairy. However, even those who consume these foods can be deficient, as the problem often lies in absorption, not intake. That's why supplementation is often necessary after 60. There are three main forms of replenishment: oral supplements, pills or drops, recommended for mild or preventive cases. The ideal dose should be guided by a professional but typically ranges from 500 to 2,000 micrograms daily, depending on the case. Intramuscular injections, recommended for moderate to severe deficiency or severe absorption issues. This ensures the vitamin goes directly into the bloodstream with near total absorption. Sublingual tablets, which dissolve under the tongue and enter circulation directly, bypassing some digestive barriers. It's important to note that excess B12 isn't toxic, as the body eliminates what it doesn't use. Still, it's best to follow medical guidance and monitor levels through blood tests. Proper supplementation means protecting your brain, nerves, and vital energy. Don't neglect this aspect of your health. Vitamin C, defense against infections and premature aging. Vitamin C is a true natural shield for the human body, especially after 60. It strengthens the immune system, fights free radicals, and participates in collagen production, essential for maintaining skin, joint, and blood vessel integrity. As we age, the body suffers more from so-called silent inflammatory processes, those that happen internally without clear symptoms but accelerate bodily wear and tear. Vitamin C acts as a potent antioxidant, neutralizing these effects and slowing cellular aging. Another key role of vitamin C is improving iron absorption in the intestines. This helps prevent anemia, common in seniors and often responsible for fatigue, paleness, and weakness. Additionally, Studies show that adequate vitamin C levels reduce the duration and severity of respiratory infections, like colds and flu, something especially important at a life stage when the immune system is naturally more vulnerable. An important fact: the human body doesn't produce vitamin C. So, it must be consumed daily, either through diet or supplementation. Foods like oranges, acerola cherries, strawberries, kiwi, broccoli, bell peppers, and kale are good sources. However, heat destroys some of the vitamin C, making supplementation an effective alternative in many cases, especially during winter or for those with restricted diets. Maintaining good levels of this vitamin means fewer infections, more energy, and firmer, healthier skin. It's a simple step that can transform how you experience aging. Few people know, but vitamin C plays a decisive role in heart health, especially after 60, when the risk of heart attack, stroke, and heart failure increases considerably. It protects blood vessel walls from inflammation and fatty plaque buildup, which can lead to artery blockage. This happens because vitamin C stimulates collagen production, essential for maintaining vessel elasticity and strength. Additionally, it helps reduce blood pressure levels in people with mild to moderate hypertension. Studies show that regular vitamin C intake is associated with improved endothelial function, the ability of vessels to relax and contract efficiently, reducing cardiovascular disease risk. Vitamin C also helps reduce LDL, bad cholesterol, oxidation. When LDL oxidizes, it becomes more dangerous and aggressive to arteries. Vitamin C acts as an antioxidant that prevents this process. And more. It enhances nitric oxide action, a molecule that dilates blood vessels and improves circulation, preventing clots and promoting more oxygen and nutrients throughout the body. In a study published in the American Journal of Clinical Nutrition, seniors with adequate vitamin C levels had a lower risk of cardiovascular mortality compared to those with deficiency. In short, taking care of your vitamin C means taking care of your heart. And when the heart is well, the whole body benefits. Vitamin K2, the guardian of arteries and bones. If there's one vitamin most people don't know about, but that can make a huge difference after 60, it's vitamin K2. Unlike K1, which participates in blood clotting, vitamin K2 has specific and essential roles in calcium regulation. It acts like a smart guide, directing calcium to where it's needed, the bones, and preventing it from accumulating where it shouldn't, like in the arteries. This detail is crucial. With age, the risk of arterial calcification increases, leading to hardened vessels, higher blood pressure, and greater risk of heart attack and stroke. K2 helps prevent this, keeping arteries clean and flexible. At the same time, it works with vitamin D to strengthen bones. While vitamin D increases calcium absorption, vitamin K2 ensures that calcium is correctly used to maintain bone density. This duo reduces the risk of fractures, osteopenia, and osteoporosis, common and dangerous conditions in older age. The main natural sources of K2 are fermented foods like natto, a Japanese soybean dish, aged cheeses, and egg yolks. However, these foods aren't always present in Western diets, so supplementation is often necessary. It's worth noting that vitamin K2 doesn't replace vitamin D, they complement each other. When used together, they create stronger protection for the cardiovascular system and skeleton. Science is clear: seniors with good K2 levels have fewer arterial plaques, better bone density, and fewer fractures. This translates to more independence, fewer hospitalizations, and a longer, higher quality life. The power duo, vitamin D plus K2. The combination of vitamins D and K2 has been one of the most studied in recent years regarding quality longevity. And for good reason. Together, they form a powerful duo to protect bones, arteries, and the heart. Vitamin D increases calcium absorption in the intestines, which is crucial for bone health. But alone, it can have a dangerous side effect, facilitating calcium buildup in blood vessels, promoting arterial calcification. That's where vitamin K2 comes in. K2 activates proteins like osteocalcin and matrix GLA, which direct calcium into bones and prevent it from depositing in arteries. In other words, K2 ensures calcium goes to the right place, strengthening bones and protecting the cardiovascular system. This interaction is especially relevant after 60, when fracture and heart disease risks rise. Combined D3 and K2 supplementation has shown significant benefits in preventing osteoporosis, reducing arterial stiffness, and improving bone mineral density. In practical terms, many supplements already offer this combination. The most common dose involves 1,000 to 2,000 IU of D3 with 90 to 180 micrograms of K2, -7 Malawian Quatches form, a type with higher bioavailability and prolonged effect. It's essential to consult a doctor before starting any supplementation. But when properly guided, this combination can be one of the most effective steps toward aging with safety, mobility, and cardiovascular protection. Aging doesn't have to mean fragility. With smart choices like this vitamin duo, it's possible to keep your body strong and arteries clear for many years. Final message: reaching 60, 70, or even 80 in good health isn't about luck, it's about choices. And among the most important is caring for the vitamins that sustain your body's daily function. You've seen how vitamin D deficiency weakens immunity, bones, and energy. Lack of B12 steals your vitality, memory, and mental balance. Low vitamin C weakens defenses and accelerates aging. Missing K2 leaves arteries vulnerable and bones fragile. These 4 vitamins aren't just nutrients, they're key pieces in your longevity. And most people only realize their importance when facing the consequences of deficiency. But you have the chance to do things differently. To care for your body before it cries for help. To maintain independence, mental clarity, and physical strength much longer. To live the coming years with vitality, not just survival. Talk to your doctor, get tested, adjust your diet, and supplement responsibly if needed. And don't keep this information to yourself. Share this video with loved ones, parents, siblings, friends. They also deserve the chance to live longer and better. If this content resonated with you, like the video, subscribe, and turn on notifications. This helps our work reach more people who need this information. And tell me in the comments, which of these vitamins do you already take? And which one did you discover might be missing in your body? I'm Dr. William Tharnell. It's been an honor to guide you here. See you in the next video. Until then, take care of yourself, because no one else can live your life for you.